Hi, my name is Brandy Williams and I'll be doing my SOAP plan on wrist arthritis. So S is for subjective. My subject is a 34-year-old African American female. She's an Olympic archer. She complains of pain and stiffness in her left wrist. It's been going on for the last 3 weeks. Medical history: she has no allergies or past conditions. Her medical condition right now is sickle cell anemia, and medications that she takes is hydroglobin. The objective is that her vitals are slightly elevated. Her BP is over 130/85. Her heart rate is 68. Her temperature is 98.9. She had a physical examination that showed swelling of her left wrist. The patient had a small fever, and she also noted that she had the loss of appetite. Radiology: there were x-rays taken. The scan shows a lot of fluid buildup around the joints in the wrist. The assessment is the patient was diagnosed with wrist arthritis. Wrist arthritis is often the cause of wrist pain, and it becomes more and more common as we age. For this patient, since she uses her wrist a lot because she does archery, her joints have been worn away. So wrist arthritis occurs when the smooth cartilage surfaces of the joints are worn away or uneven bony surfaces are exposed. The wrist joints can become stiff, swollen, and painful. So our goal is to help her manage the symptoms, because unfortunately wrist arthritis or any arthritis does not have a cure. So the plan will be RICE for 3 weeks. You'll rest and limit activities using your wrist. You will ice your wrist on and off. You would compress your wrist by wearing bandages or a special glove that you see in the picture to your right. And you will also elevate the wrist by putting it above your heart so it can reduce swelling. Her best option after the 3 weeks of RICE would be to wear a specialized arthritis glove. When doing archery, the best that she can do right now is manage the symptoms. And those are is my reference. There you go. Bye.